All right, welcome everybody. This is week 9 where we're talking about the skin and some dermatology issues. This is a shorter unit, and our book doesn't do a good job of covering it all. Therefore, we will rely heavily on the external videos and sources for the information that I will provide to you for this unit. Fortunately, there are many other sources that do a good job of covering dermatology issues as well as skin issues, and I have provided some external resources for you as well in the Schoology classroom, so be sure to check those out. Just like many other conditions we're learning about in this course, it helps to have a good understanding of anatomy and physiology before delving deeper into the actual issues. I'll cover this briefly here, but I also encourage you to take a look further into each of the layers of the skin. The skin is the largest organ and it functions as protection for us and for our body. It also functions in temperature regulation, sensation, metabolism, and this is especially true for vitamin D. It does make up approximately 15% of an adult's body weight, so it is a pretty important organ for us. The skin itself is made up of the epidermis, followed by the dermis, and then below that is a layer of subcutaneous tissue. Within these subcutaneous and dermal layers, there are some appendages that include sweat glands, sebaceous glands, as well as the hair follicles. All are important for this unit. It is pretty important to know how to describe some of these common skin lesions. So you'll see here 2 pictures that I believe do a reasonable job of giving you a good description, and with some pictures there, which can certainly be helpful as well. Skin changes during pregnancy can increase the vascular dilation, which may allow more absorption of topical medications. In addition, there's an increase of the striae gravidum, and there's also an increase in the sweat gland function. Breastfeeding women can experience many dermatological issues, especially involving the breast, and this is important to address right away as conditions that may cause nipple pain are also one of the most common reasons that women will discontinue breastfeeding. So treatments of skin disorders. Well, compared to some of the oral therapies, there are topical agents that are frequently have lower levels of systemic absorption. They also avoid that first pass effect that is seen with oral therapies. There are many different topical options, which include patches, creams, emulsions, foams, gels, paste, powders, or even sprays. Topical steroids can be prescribed in several potency levels, going from 1 to 7, with 1 being the most potent. And I have a good chart here that may show or that shows many of these formulations. The high potency steroids can cause skin atrophy, striae, hypopigmentation, decreased immune function of the skin cells. They can worsen rosacea. Also, adrenal suppression is uncommon, is uncommon when used topically, but do have a possible serious side effect with some of the higher dose steroids. Mild or low dose steroids appear to be compatible with breastfeeding, but have been reported to increase the risk of stretch marks. Our oral steroids include drugs like prednisone or methylprednisolone. They generally are used for rare situations like poison ivy or poison oak, or when topical steroids are not effective enough. They should be taken in the morning and with food, and sometimes need to be tapered off slowly rather than abruptly stopped, although this is pretty dose and treatment length dependent. Again, adrenal insufficiency is rare, but signs and symptoms of this would include hypoglycemia, hypotension, dehydration, and mental confusion. When taken in the first trimester, there is also an increased risk of oral facial defects in baby, so those would want to be avoided. Antihistamines are very common drugs, and in pregnancy, itching is commonly experienced, but there are many possible causes for this, so the patient should be fully evaluated, especially in cases where there's no clear dermatological source of irritation. Treatment of women with itching, also known as pruritus, often include topical or systemic antihistamines. The classic medication, diphenhydramine, also known as Benadryl, is a first-generation antihistamine that is a sedating antihistamine, meaning it can cause drowsiness and things like dry mouth. Less sedating options are those second-generation ones, and this include drugs like loratadine, also known as Claritin, as well as sertrazine, better known as Zyrtec. These are typically considered safe in pregnancy. Skin damage has many different causes. When we're thinking about the sun, shade, clothing, and sunscreen are probably the three most important things you can do or recommend to your clients. The American Academy of Dermatology has some wonderful resources available for free to help answer many of the questions that clients or yourself may have. Sunscreen is regulated by the FDA, and as you know, it can be purchased over the counter. The FDA classifies anything that is intended to diagnose, cure, mitigate, treat, or prevent disease as a drug, and sunscreen is classified as a drug because it can prevent sunburn, and if a broad spectrum is used, it can reduce skin cancer and decrease early skin aging. So burns can be minor burns like first degree that are superficial and the skin remains intact. For these types of burns, we often use some topical anesthetics like lidocaine, which helps with the pain. Herbal products can also be used like aloe vera gel, which can be applied for relief of the heat and also pain, and can be used 3 to 4 times a day. Tea tree oil is another thing that is used and applied 2 to 3 times a day. Second-degree burns include blistering and affect the epidermis as well as parts of the dermis. These are partial thickness burns, and then the third-degree burns are full thickness burns, and those destroy the epidermis and dermis while also extending into the subcutaneous tissue. Silver sulfalazine cream, also known as Silvadene, and this is a topical sulfa antimicrobial that is used for both second and third degree burns. We do try to avoid this near the end of term in pregnancy because of maternal absorption can increase the risk of neonatal keratinosis. The World Health Organization has said that Silvadene cream is safe during breastfeeding. Lastly, here is akinetic keratosis, which is a precancerous condition that is the result of UV damage, and about 1 to 5% proceed to squamous cell carcinoma. We can treat these areas with surgical removal, or there's also some medical options as well. Imiquid is a topical immune modulator. There's also retinoids to treat this medically. There is no clear guidance on how these are in pregnancy. So like many other things, we try to avoid the use in pregnancy when able. All right, next up are some of our skin cancers, and these are the most common type of cancer in the US, and more than 90% of skin cancers are related to exposure of UV light. The most common of these cancers are basal and squamous cells, and the rarest would be melanoma. Melanoma is also the most concerning skin cancer. The cumulative sun exposure and the number of sunburns throughout your lifetime increase the risk of melanoma, and actually a single blistering sunburn during or prior to adolescence will double a woman's chance of getting it, but also more than 5 sunburns over the course of your lifetime would also double the risk of melanoma. So prevention for skin cancer is always best, and the American Academy of Dermatology has tips to reduce the risk of developing skin cancer. The first one is to practice safe sun. So by doing this, you are seeking shade, wearing sun protective clothing, and applying sunscreens. The second is to reapply sunscreen often. So when you're outdoors, you want to reapply at least every 2 hours, and certainly after swimming or sweating or toweling off. The third is to forget about indoor tanning, as evidence from many studies show that indoor tanning devices can increase the risk of developing melanoma, as well as other skin cancers, and they emit pretty harmful UV rays. In some cases, it's stronger than the sun's rays. The fourth is to forget about getting a base tan, as tanning is not a good way to protect your skin from sunburn. Every time you tan, you actually damage your skin, and that damage builds up over time, thus increasing the risk of skin cancer. And the fifth one is really just for those people who feel like they need to have a tan. The recommendation would be to use a self-tanner, as this doesn't expose your skin to harmful UV rays. But keep in mind that also it doesn't protect your skin from harmful UV rays. So you want to make sure you practice what we talked about in that first one under safe sun. Some other conditions, dermatitis is really an umbrella term that indicates that an inflammatory process of the skin is occurring. Atopic dermatitis, also known as eczema, happens because of genetics and also inflammatory responses. The condition is a chronic disease and it relapses or has flares. It is usually initially seen in early childhood, and oftentimes there's a a personal or family history of childhood asthma. Criteria for diagnosing includes this dry, puretic skin that's primarily in the flexural areas, so the creases of the elbow or in the neck are common. And it often has a thickened or pronounced texture as well. Cirrhosis or dry skin can lead to reoccurrences of atopic dermatitis, so dehydration or decreased water storage in the skin precipitates this, and some of the symptoms of cirrhosis. In addition, factors like aging or excessive washing or exposure to extreme weather can also contribute to this problem. Emollients or moisturizers are often first-line treatment for women with dry skin, and moisturizers often have added humectant, which is an ingredient like glycerin or urea that facilitates water absorption. Moisturizers can also contain emollients, which are products that soften the skin, most likely by filling the spaces between the skin and thus smoothing rough skin and replacing some of the natural skin lipids. Most common side effects from emollients and moisturizers are stinging or other skin sensations, and true allergies to these are pretty rare. However, some cosmetic moisturizers can contain fragrances that a person could react to. Many times, simple skin lubrication can reduce the risk of dryness and then decrease the risk of corticosteroid treatments being needed. We often recommend a thick cream or ointment rather than a lotion, as lotions contain more water compared to the creams and therefore are more likely to dehydrate the skin. Steroid therapy, when indicated, is used to suppress symptoms of atopic dermatitis, although use is usually limited to flares or when the moisturizing treatments are not effective enough. And these are usually low potency steroids when needed. The calcineurin inhibitors, I won't get into much about these, but know that these are immunosuppressants that can inhibit cytokines and can reduce inflammation. These are often used more of a last resort, especially in our pregnant or lactating women. And there are occasions where women with atopic dermatitis don't respond to the usual treatments, and then other drugs may be used, like systemic immunosuppressants, such as methotrexate, careful watch of a specialist. In addition to some of these pharmacological management options that we've discussed, of course, counseling should include information about identifying and avoiding some of the environmental triggers, as well as allergens that cause symptoms. At times, the itching can be so severe that antihistamines are needed for some symptomatic relief. So allergic dermatitis is caused by direct exposure or contact with the substance, and the person can either have an allergic response or an irritant response. The classic skin allergy is that of exposure to poison ivy, which produces a pretty powerful allergen. But other common allergies include like nickel or chemicals and preservatives that are found in clothing and household products, as well as antibiotics or topical medications. The primary symptom when someone is having an allergic response is intense itching, and the area may also have some papules or vesicles or erythema. Treatment for these mild allergic responses include getting rid of whatever is causing it, as well as applying drying agents like calamine, which is a mixture of zinc oxide and iron. You can also use soothing lotions like Aveeno, which is a combination of a colloidal oatmeal as well as glycerin. And then there are topical steroid creams, which can help relieve symptoms as well. Again, those are for mild treatments. Seborrheic dermatitis usually appears like a flaky or reddened or greasy skin, and most typically on the scalp, but it can also be on the face, especially in the nasolabial folds and on the chest as well. When it appears on the scalp, sometimes it's termed dandruff, but infantile or neonatal seborrheic dermatitis is also known as cradle cap. This condition does require pretty persistent treatment to control the symptoms. Ketoconazole is one drug that the FDA approved for treatment of seborrheic dermatitis. However, a variety of products are effective at including selenium sulfide shampoo like Selsun Blue and other topical antifungals such as tributafine or Lamisil. There are also some treatments with UV light to improve some of these lesions, and also tea tree oil has been proposed as a natural treatment for it. However, keep in mind that because this is an essential oil, there is a risk of contact dermatitis, especially if the solution is a strong one. I mentioned the topical ketoconazole creams, and this is considered compatible with pregnancy based on the limited data that is available. So psoriasis, when we're thinking about psoriasis, keep in mind that this is a chronic skin disorder that affects all races and genders. It commonly has an onset in the teenage years between 15 and 20 years of age, but then it also peaks again around the age of 55. There are several genes that seem to predispose someone to developing psoriasis, as well as some environmental triggers. Smoking does appear to increase the likelihood of psoriasis, and smoking cessation can actually decrease the severity of symptoms, so another good reason to quit. Plaque psoriasis is the most common type of psoriasis, and it makes up about 80% of the cases. Treatment of psoriasis really depends on the type and severity, whereas mild psoriasis can start with topical medications and then progress to light therapy, all the way up to systemic treatments. Steroids do work pretty quickly, but do become less effective over time, and these are given by applying a small amount, usually like a pea-sized amount to the lesion. Severe psoriasis can be treated with some of these systemic therapies like methotrexate and retinoids are also an alternative therapy. All of these systemic retinoids are contraindicated in pregnancy, and women should be on effective birth control if they're using this type of therapy. Tar, especially coal tar, is used as an exclusive and emollient product that slows the proliferation of skin cells, and there's also shampoos with this in it as well. Tar products do increase the sun sensitivity, so there is a risk of that, as well as a risk of staining. I do note that some studies suggest that coal tar should not be used while breastfeeding. All right, moving on to acne. When thinking about acne, this is a term of basically persistent comedones, nodules, or pustules was developed from some of the sebaceous follicles. It can be non-inflammatory, which includes the comedones like blackheads, or inflammatory, which includes pustules or papules. Acne is typically categorized as either mild, moderate, or severe, and this guides treatment as well. Treatment is typically divided into preventative or drying, as well as antibacterial categories, and this depends on the severity of the outbreak. The use of hormonal contraceptives can offer an additional therapeutic option for managing the symptoms of acne and is especially useful for sexually active women who want to avoid pregnancy. There is typically a stepwise pathways to choosing the appropriate therapy for acne, and this includes the uses of those topical agents such as benzoyl peroxide, as well as topical retinoids for mild acne, unless the woman is pregnant, and then those are contraindicated. There are also topical or oral anti-infective options as well, and I have these options listed in the charts on the next couple of slides for you. Please take note that one of the ones that are indicated for methicillin-resistant Staphylococcus aureus, or MRSA, as these do require specialized treatment to make sure we are covering for this organism, and we'll discuss that more in a couple of slides. For more moderate to severe inflammatory disease, Accutane can be used in non-pregnant women. And then there's also spironolactone, which we'll discuss in a later unit, but that's an anti-androgenic agent that has been suggested for therapy as well. So these are the topical anti-infective options, and I'll let you just read through the chart on your own. These are the oral anti-infective options. The beta-lactam antibiotics are the most, and most of the topical anti-infective agents are considered safe for use during pregnancy, although dosing may need to be adjusted because of the increased rate of drug elimination. In contrast to this, tetracycline is typically contraindicated after 15 weeks because of the risk of fetal tooth and bone malformation. There are some new studies coming out on this, but I won't get into details as some of them are preliminary at this time. Women who breastfeed while also taking antibiotics should watch out for complications in baby like diarrhea, dehydration, or things like thrush. While not anti-infective treatments, as I mentioned earlier, retinoids are contraindication contraindicated in pregnancy, and spironolactone should not be used by pregnant women or by those who are planning a pregnancy because that is known to cause feminization in male fetuses, but spironolactone is often considered safe in breastfeeding. So again, the picture here shows the oral anti-infective options, and I will let you read through those ones on your own. Hirsutism is excessive hair growth, and it's best to avoid treatments while pregnant or breastfeeding. Alopecia is thin hair, which is often prominent during times of excessive stress. You've heard this before, but there is not enough data to safely recommend treatment during pregnancy. For non-pregnant clients, however, things like minoxidil, which is Rogaine, is typically available over the counter, and it's a safe and effective treatment, but it does require patience as hair takes time to grow, and it may need to be taken long term as well. So many different infections of the skin as well as cutaneous tissue. Many of the bacterial skin issues are caused by Staphylococcus aureus and less commonly a Streptococcus species. Furnicles are nodules that form following folliculitis. When the infection is mild, then things like over-the-counter products like bacitracin, neomycin, or some of the triple antibiotic creams can be considered. Carbuncules are boils and are subcutaneous abscesses, often of a deeper and more extensive infection that may require longer courses of therapy as well as incision and drainage to remove. Cephalexin, also known as Keflex, is often a treatment of choice as this is a first-generation cephalosporin that covers most gram-positive organisms as well as gram-negative aerobes, but persistent infections may require a third-generation cephalosporin, which we talked about in the antibiotic unit. Cellulitis then is a deeper infection of the skin tissue or the soft tissue, which typically appear as swollen, erythematous, warm, and tender tissue. Often in hospital parenteral or IV therapies is indicated for treatments of cellulitis. Whenever skin infections do not respond to first-line treatment, the possibility of a methicillin-resistant Staphylococcus aureus or MRSA infection must be considered. Lesions can be cultured for this, and when this is found, treatment needs to be appropriate as it can be a very serious infection if left untreated. Treatment may include surgery depending on the area and size of lesion. Antibiotics include drugs like vancomycin, clindamycin, or Bactrim. Ongoing wound care and sometimes hospitalization is also required. All right, so moving on to some of our fungal infections. When we think of the fungal skin infections, they are the dermatophytes, which are a group of fungi that infect keratinized tissues such as skin, hair, or nails. These include the tinea infections that are shown here in the picture, and I'll allow you to look over these on your own, but there's some really good information provided there. Uncomosis is a fungal infection of the nail and the nail bed. And then antifungal treatments are used for these, and they can be topical or oral. On the next slide, I have a list of many of these agents for you. And here those are. All right, some of our other skin conditions are things like scabies, lice, fleas, ticks. Scabies is a very common skin infection that is caused by a microscopic mite that is found worldwide. These infections are associated with sharing personal items like clothing or having close personal contact, as well as crowding. Symptoms are typically noted first on the webbing between the fingers or toes and areas where there is constriction from clothing. Severe itching is a pretty classic symptom, but can take 4 weeks or more to develop after the initial exposure. Itching, itching is often severe at night and can cause some sleep disturbances. Treatment includes washing all the personal items and household surfaces. Items that can't be washed need to be stored in a sealed plastic bag. Usually, the recommendation is for at least several weeks or placed into a hot dryer. Permethrin cream is the first line topical treatment. It kills mice and also lice by disrupting the cell membranes. Lice can be head lice or body lice, but then there's also crab or pubic lice, and these are all spread through contact of various forms. As I mentioned, lice is also killed by the use of permethrin. Fleas and ticks, then, are pests that are located across the US. Bubonic plague is a flea-borne illness, and cases do happen, but they are pretty rare in the US currently. There are also many tick-borne illnesses, and these vary based on geographical location. Prevention is key for both flea and ticks, and sprays or repellents that contain DEET are typically recommended. Symptoms of tick illnesses include fever, chills, rash, aches and pains, or just generalized fatigue. So these are often mistaken for other issues initially. Tick disease may require more specific treatment for the diseases that come from them, like Lyme disease, Rocky Mountain spotted fever, or alpha gal, as well as many others. The CDC, as well as many of the local DNR offices, have good information on ticks that can be broken down into your specific geographical location. And I highly encourage you to look these up. Depending on the illness, antibiotics may be needed. And then lastly, these are just a few of the resources for some different dermatology issues. The American Academy of Dermatology is the first website I have listed here, and that provides updated guidelines for a wide range of dermatological conditions. And then the CDC is the federal site, which includes some good information on things like MRSA, tick-borne illnesses, psoriasis, and many of the other conditions we discussed today. Sorry, the CDC website is just cdc.gov. I'm not sure why it's not showing up there. I thought I included it. And that is all that I have for you today. Please be sure you continue to watch the rest of the lecture series, which includes some external videos. Take care and have a great day. Let me know if you have any questions or issues arise during class.